Now we will discuss about vitamin B2. Vitamin B2, it is also called as riboflavin. So other name of vitamin B2 is riboflavin. We will discuss its functions and deficiency. Function of vitamin B2 are it is component of flavins, FAD and FMN. FAD is and FMN. FAD is flavin adenine dinucleotide and FMN is flavin mononucleotide. They are used as cofactor in redox reactions. For example, the succinate dehydrogenase reaction in the TCA cycle. So these are cofactors. FAD and FMN are derived from riboflavin. B2 is equal to 2 ATP. So deficiency of vitamin B2 causes cheilitis. Cheilitis is inflammation of lips, scaling and fissures at the corners of the mouth. Magenta tongue. Magenta tongue is like purple tongue and corneal vascularization. The two C's of B2. So it causes cheilitis, inflammation of lips, scaling and fissures at the corner of mouth. Magenta tongue, purple tongue, corneal vascularization, etc. Vitamin B3. Vitamin B3 also called as niacin, nicotinic acid. Other name of vitamin B3 are niacin and nicotinic acid. Function: it is constituent of NAD positive and NAD positive, used in redox reactions and as cofactor by dehydrogenases. And vitamin B3, it is derived from tryptophan. Synthesis require vitamin B2 and B6. So for synthesis of vitamin B3, vitamin B2 and B6 are required, used to treat dyslipidemia. Dyslipidemias are very low density lipoproteins and very high HDL levels. So it is used to treat dyslipidemias. NAD is derived from niacin. B3 is equal to 3 ATP. Deficiency of vitamin B3 causes glossitis. Glossitis is redness or inflammation of the tongue. Severe deficiency of vitamin B3 leads to pellagra, which can also be caused by Hartnup disease. Pellagra is also caused by Hartnup disease and vitamin B3 deficiency. Malignant carcinoid syndrome, increased tryptophan metabolism, increased serotonin synthesis, and isoniazid, decreased vitamin B6. Symptoms of vitamin B3 deficiency are pellagra. The three Ds are diarrhea, dementia, also hallucinations, dermatitis, C3 and C4 dermatome circumferential, broad color rash, that is also known as Castle necklace, hyperpigmentation of sun exposed limbs. These are also symptoms of vitamin B3. Hartnup disease, autosomal recessive deficiency of neutral amino acids, for example tryptophan, transporters in proximal renal tubular cells and on enterocytes, neutral amino aciduria, and decreased absorption from the gut. Decreased tryptophan for conversion to niacin. There it leads to pellagra-like symptoms. It is treated with high protein diet and nicotinic acid. So we use high protein diet and nicotinic acid for its treatment. Pellagra is vitamin B3 levels fall. When vitamin B3 level fell, then pellagra happen. Excess of vitamin B3 or niacin leads to facial flushing induced by prostaglandin, not histamine. So it is induced by prostaglandin. Can avoid by taking aspirin before niacin. If you take aspirin before niacin, so we can avoid this. pruritus, rash, hyperglycemia, hyperuricemia. It can cause this. Podagra is equal to vitamin B3 OD overdose. When there is overdose of vitamin B3, then pellagra happen. Vitamin B5, it is also called pantothenic acid. Vitamin B5 is pantothenic acid. Function, we will discuss its function and deficiency. The main function of vitamin B5 are, it is component of coenzyme A. This is coenzyme A. It is a cofactor for acid transfers and fatty acid synthesis. So it is mainly used for fatty acid synthesis. So deficiency of pantothenic acid or vitamin B5 leads to dermatitis, inflammation of skin, enteritis. Enteritis is inflammation of bowel, something, alopecia, thinning of hairs, adrenal insufficiency may lead to burning sensation of feet, burning feet syndrome, distal paresthesia and dysesthesia. These are like tingling sensations and burning sensation, like needles piercing on the skin, like sensation on skin, paresthesia and dysesthesias, tingling sensation, and like piercing needles like sensations due to deficiency of pantothenic acid or vitamin B5.